My guest today is Dr. Chris Milburn. Chris Milburn was the head of the emergency services for the Eastern Zone in Nova Scotia when he was let go in June of 2021 after appearing on a CBC radio interview where he was skeptical of the lockdown measures imposed on Nova Scotians. It's an honor to have you tonight, man. Thanks for coming in.
Thank you very much. I appreciate you talking to me.
Awesome. So I want to go back to the start of your story. The start of this part of the story, when the pandemic was, in full swing in June of 2021, and you went on the CBC interview. What exactly did you say? Like, what was so controversial?
I remember the interview well. I actually ended up getting a copy of it, and I've kept it for posterity. I think I can break it down to 3 points I made, which were felt to be controversial. I was told that I wasn't being part of a team, and that's why they let me go. The three things were, number one, at that time, kids were just being allowed back to school again. They had shut down schools again, even though kids that weren't at risk, and we knew that very well by then. And they were just letting kids go back. And some parents were still terrified that their poor little darlings were going to die of COVID. And so it was a bit controversial, and people felt, oh, this Dr. Strang guy is a wild man letting my kids go back to school. Isn't this terrible? And so the question, it was part of this issue panel, which is a group of 3 people who were invited on to the CBC to discuss topical issues. And so the question was, do you think it's right to let kids go back to school? And I said, not only do I think it's right, I think it was terrible that kids were ever out of school. The data showed that was unnecessary. We know that it's hard for kids. We know that it's especially hard on kids who don't have a lot of support at home. So I basically said it's far past time we're letting them back, and parents shouldn't be nervous about it if they understood the stats. The second thing was the vaccines had, just started to come into wide circulation, and there was talk of the government making them mandatory, but we were quite a bit away from that at that time. We were still a couple of months before it was mandatory. And the issue of should vaccines be mandatory came up, and I opposed it extremely strongly on, number one, just on the basis of morality and civil liberties, and the idea that we, as a medical profession, it would be okay to force anybody to put anything into their body was wrong to me, even if we knew that the vaccine was, quote unquote, safe and effective. But at that time, we were far from knowing if it was effective, and we were still far from knowing if it was safe. So I said, number one, it's wrong morally. Number two, we don't know if it's safe yet. Number 3, we don't know if it's effective. And so that was very controversial. The third thing I said, which was the point that maybe I was the most, the point that maybe I'd make differently, but basically I talked about the medical officers of health being given too much power. It was like, governments who are accountable to us in theory had given over the keys to the provincial car to the medical officer of health and said, you drive it wherever you see fit. And then anything we would complain about, they'd just say, we're just going by public health. But the medical officer of health is not accountable. He's appointed. He's not elected or anything. We can't boot Dr. Strang out if we didn't like him in Nova Scotia. And so my point was, unaccountable appointed officials, bureaucrats, should not be given the keys to the kingdom. The decisions have to be made by politicians. And history tells us that anyone who is given unaccountable power becomes corrupt and high on that power eventually. It's just inevitable. And that's why we don't do it in a modern society, or shouldn't do it in modern society. And that was taken as very controversial because it was taken as a slap against Strang, who many people felt had gotten kind of a little into himself at that point. So,
I remember it well. Like, we had the, I remember, like, how much Stay the Blazes home merchandise was there. Like, I'm pretty sure there was a Dr. Strang bobblehead at one point. You know what I mean? Like, the whole thing was kind of silly in that regard. And I want to go back to what you said about, I remember that well. I remember, like, for the longest time, people were, like, I don't want to say worshipping Dr. Strang, but they were sort of worshipping Dr. Strang, right? Like, there was, like, a really, like, sort of weird, like I don't know, savior complex or something going on there. And like when you said parents started calling him a wild man for wanting to send their kids back to school, I remember finding that like so crazy. You know what I mean? Like I was thinking at the time, like yes, absolutely, they should be back in school, and like just to watch the same people that were just worshiping him, just like all of a sudden start to be like, what is he doing? Like, yeah, that was absolutely crazy, man.
It was a wild time. Like, it was interesting because I'll tell you, my just people may not know me who are listening to this, but I was very involved with public health for many years before that on a couple of different levels, nationally, provincially, locally. And I actually had some dealings with Dr. Strang over time on issues like Lyme disease and on issues like bicycle lanes and different, physical activity promotion things. And I'd always found him very cordial and reasonable. But people didn't realize he had been the medical officer of health for Nova Scotia for about 20 years before COVID hit. Nobody knew his name. Nobody knew his name, which is how it should be, because the medical officer of health is not somebody who should be your ruler. He should be somebody who you have nothing to do with. He basically could give advice to the government on, which vaccine should be recommended, where do we think this leptospirosis outbreak started, and what can we do to stop it, things like that. But by the time any rubber meets the road in terms of policy, it should be several layers distant from Dr. Strang. He shouldn't be writing policy. He should be advising behind the scenes. And that's the way it was. Nobody ever knew him. Doctors, some of us knew his name. I'd say most doctors wouldn't even know his name, but those of us who rubbed up against public health in different ways probably knew his name. But he basically sat in a basement office in Halifax and put out memorandums every year saying, make sure you all get your flu shot. And that was about all he did. And then all of a sudden he was thrust into the spotlight and became a hero, and people have pictures of him up in their house. And there's now a Dr. Strang Award in Nova Scotia for promotion of public health and all these things. So yeah, he really was put on a pedestal. And it was quite bizarre. We started to worship at the altar of public health all of a sudden, whereas we never cared about it before COVID.
Yeah, absolutely, man. That's so true. And and like, I know what you mean about him. Like, you probably had a relationship with him. You said, like, he was always cordial and this and that. But I just remember some of the things he was saying on TV were just absolutely, like... I remember at one point, people were upset. Like, I think this was before the vaccines rolled out. If I remember correctly, it was probably, like, May of 21. I think that was the Delta wave, maybe. So we had another mini shutdown. You know what I mean? And... they imposed like actual, like they said you couldn't leave your county, you would get a fine. And a lot of people, like some people, were in an uproar about it. Like, well, what if I want to go to the cottage? No, don't go to the cottage. It's selfish to go to your cottage. You know what I mean? Just stuff like that was absolutely insane. Okay, so wait a second. You think it's more dangerous for me to drive with my family out to the woods across county lines where I'm going to interact with nobody than to stay in the city and go to the grocery store? Like, it doesn't make any sense. None of it did.
On the surface, some of the things that they did to begin with made sense. Like on the surface, when you dug into them, they didn't. But this whole idea of quote unquote social distancing, which is basically social isolation with a nicer term slapped onto it. But you isolating yourself socially, okay. If there's a bad disease going on, if Ebola is circulating, you probably don't want to go near a lot of people.
Absolutely.
That theoretically could have made sense. Masking on the surface, when you don't understand it, it's like, oh well, that makes me feel safe to wear a mask. And so some of the rules kind of made sense, but very quickly, like, a lot of them were just ridiculous. Things like in Sydney, for instance, they shut down a park that has about probably 18-foot wide pathways. There are pathways that are big enough you can drive a big pickup truck down one side of it and people can still walk around you. They shut down that park, but then you could go walk on the sidewalks, which are whatever, 4 feet wide. And the sidewalks got more crowded because you weren't allowed in the parks, you weren't allowed here and there. So it's like, go walk on the crowded sidewalks because that's somehow safer, but the park is shut down. And then things got crazier and crazier. And I think where a lot of people started to realize, oh, okay, wait a minute, this is all crazy. Was when remember with the rule, you went to a restaurant, you go to a restaurant and sit there with a bunch of people, and you could take your mask off
Yeah.
if you sat down, but if God forbid you stand up, get your mask back on, or somebody would yell at you.
Oh, you would get looks too. It was perfectly okay to just sit down with your wife, or maybe, if everybody had been good to other people, you know what I mean? Like, ooh, you're allowed a table of 4 now. But yeah, no, you would stand up and all of a sudden you were persona non grata if you just went to the bathroom without a mask, even though you're talking and chewing, and it just, yeah.
It was wild, and the wildest thing about that is long after there were any official mask rules, I would see people walk into a restaurant with a mask on, go over, sit down, then take their mask off, and it's like, oh my God, it's bad enough you did it when you had to, but now you've internalized that,
Yeah.
and now you're just doing it because you do it, and wow, like how crazy are some people? Like you've actually internalized these things that are absolutely ridiculous, but they become part of you now. And that was sad when I saw that happening even after the rule was gone.
Well, I haven't seen this in about a year, to be fair, but into 2023, maybe even the start of 2024, I not kidding, I've seen people like alone in their cars. Not another passenger, just alone, just chilling with a mask on. It's yeah, it's pretty crazy. Joe Rogan actually had a pretty good joke about this on his last comedy special. Like, not to paraphrase him, but he was like, "Yeah, COVID was terrible. We lost a lot of people, and most of them are still here."
Oh, I love that. That's great.
Yeah,
That's awesome.
yeah, man. But yeah, so like getting back to like when you were let go. Like the vaccine passport thing, like I know you touched on that, and that's another thing that's really crazy to me because I remember that well. It was June of 2021, right?
Yeah.
They had just, I don't think it was even available for my age group yet. Like I feel like people my age were just starting to get it, maybe. I might be remembering this wrong, but like you're a healthcare worker, right? So, well, you were unfortunately before, but are
Yeah.
you still practicing medicine?
I am indeed. My life is extremely different now. I work as a family doctor in a little village in Nova
Okay.
Scotia, a coastal village. So I don't work in the big emerge anymore in Sydney. I'm not involved with organizing anything. I have no positions of authority, but I'm just a little old small town family doc now. And in many ways, probably my life is better. So everything works out for a reason. Yeah.
Well, that's terrific, man. I'm happy to hear that. But yeah, so it was like June of 2021. The vaccine hadn't been available for my age group yet, and I just, yeah, like I remember like how crazy it was that they were talking about like passports already. Like the writing was already on the wall. You know what I mean? Like and I just at that time I did not feel comfortable getting it. I did end up getting it in right when the federal mandate hit, because like where I work, like I'm an independent contractor, but like I have to work, like I have to access a federal building, so yeah, I had to do it. It was a choice between, being able to feed my family and not. In retrospect, I wish I'd stuck to my principles, but I had to do what I had to do. And honestly, if I believed it was going to be like, if I thought it was like a 5G chip or something, or like a bioweapon that's going to kill me, I wouldn't have done it. I would have got another shitty job. You know what I mean? But I feel like the risk. Is it fair to say that the risk reward ratio just wasn't there for like somebody of my age group, or maybe even yours?
Here's what I thought right from the start, and I've kind of adjusted my thinking as time went on. By the time the vaccines were available in 2021, we knew a lot about the disease. We knew a lot about who was at risk and who wasn't at risk. What was the magnitude of the risk? Because everything in life carries a risk, right? You can walk out of your door tonight and you could get hit by a meteorite. It's just extremely unlikely. Only one or two people in history have died of getting hit by meteorites. You can die of leptospirosis. It's just incredibly rare. So whenever we suggest a medical intervention, the way I would phrase it, that every medical intervention, every test you get, every treatment you might get is always about risk-benefit ratio. And by the nature of that, we can't say that something is good for everyone, right? Besides saying things like don't smoke, in general, don't smoke is good for everyone, or in general, get exercise is good for everyone. But as soon as you get into any actual medical treatments, drugs, tests, whatever, it's like not everybody needs a CAT scan of their lungs. Some people do if you have certain symptoms, but not everybody does. And not everybody like chemotherapy is a great medication if you have cancer.
Of course, yeah.
But otherwise, you really, really don't want to take chemotherapy. When you get into vaccines, like there's a vaccine for yellow fever. It's a very safe vaccine, and people who are traveling to, let's say, the outer Borneo to do some hiking might get a yellow fever vaccine.
Yeah, of course. My brother went to Africa like a couple, like, a long time ago, but yeah, he had like a whole laundry list of shots that he had to get for like
absolutely,
real things that could kill him there for sure. Like,
yeah, absolutely. And so those vaccines make a lot of sense if you are at risk for the disease. But the problem is when we try to vaccinate people, when we suggest vaccinating people who are at very low risk for something, then you get into a situation where the vaccine, even if it's not a terribly risky vaccine, even if your odds of dying from a vaccine side effect are 1 in a million, that's a very safe vaccine. If the risk of the disease is only 1 in 2 million, well, you're much more likely to die from the vaccine than from the disease. So you don't give it to that person. And we knew at the time we were vaccinating children, we knew that the disease was really, really, really benign for kids. There wasn't one healthy child in Canada who died of COVID. I worked right through the COVID debacle, and I never saw a kid who was seriously ill from COVID, let alone, on death's door or in the ICU or anything. So the idea that we would have to not just suggest vaccinating these kids with a vaccine with unknown side effects, but the thought that we would force them to be able to go to school or go to their activities.
Oh, yeah, it's
crazy. It was actually crazy.
It's inexcusable, to be honest. And you can look at this. I don't know if you've been following. Honestly, like I've been trying to move on from this whole COVID stuff, but at the same time, like this is like a core issue for me that I really like. I hope we don't all put in the rearview mirror. I think it's important to have these conversations. Yeah, like you can see it in the numbers of like, have you been following the data of like which populations have been getting vaccinated the most? Because when you look at the 12 plus, like our vaccination uptick is very high for like kids. And I mean like 12-year-old kids and younger teenagers. You know what I mean? Like it's very high, obviously, because they wanted to play in their sports teams, like their parents felt like they had to do it. But you look at like the 5 to 11 age group, almost nobody did it. I think it's still to this day under 30%. Correct me if I'm wrong, but like I said, I haven't paid attention to the stats and like really closely in a couple of years, but I remember like articles on CBC about how shockingly low the uptick is for 5 to 11. And it just goes to show you that like people who are willing to just immediately get it for themselves and shame their neighbors for not doing it, like they'll never admit it out loud, but they were very hesitant when it came to their own children. And
I think that's true. I think that's true because I think by the time the vaccines rolled out and by the time they were being suggested for kids, I think a lot of parents had figured out that, okay, wait, my kid's not really at risk, right? And so that coming back to this risk-benefit ratio, maybe, and people I greatly respect will argue that it did make sense to vaccinate elderly people. And by elderly, probably like 75 plus, 70 plus, 65
I'm willing to hear that argument too.
Yep. Who am I to say? I don't like to have a closed mind. I still think probably the risk was greater than the benefit, even in that age group. But I don't know. So people like Jay Bhattacharya, who I have great respect for, and is a much smarter man than me, he still feels that it probably made sense for the elderly age groups, the elderly at risk age groups. So, I have a lot of time for Jay. On the other hand, there's some people I really respect who say these things are clot shots and they were killing everybody and the data was clear. And I have respect for their opinion too. And in the end, to me, being right and being strident about my opinion on the science is not so important as the more fundamental issue. And the fundamental issue is we never should have forced anyone. It's not wrong. The medical establishment, science, we've been wrong over and over and over again. That is the nature of science. We get it wrong, we get it wrong, we get it wrong, we get more data, now we get it right. It's fine to be wrong, but it's not fine to force people to do things. That's that underlying moral principle is what we really violated in my mind, not the fact that we got the science wrong.
100%. And like it makes it more unforgivable when you look at how people who were hesitant about it, or people who were like downright pissed off and vocal, like it culminated in the trucker protest, like as you know, just the way they were treated. But they were right. Like, I'm sorry, but they were correct about everything. The arguments they were making the entire time, like, again, except for like, because there are some people on like my quote unquote side that really don't do the rest of us any favors when they start like, because they're actual people that are just like, oh, there's microchips, you know what I mean? Like, but all that aside, like, all the points they were making have held up today. Like it doesn't seem evident to me. Like, people were saying the entire time, like, you need to get this so that I'm safe, but you took the thing, so you're safe. So what does it matter if I'm unvaccinated? You know what I mean? And you ask people this honestly, and you watch them short circuit.
Absolutely. Yeah. And so I think I right from really from the time the mask mandates kicked in, I think it was in the summer of 2020, my argument to a lot of people who were kind of on, let's say, my side of the COVID divide, saying we're overdoing it, everybody's got to calm down. My argument was we're being drawn onto the wrong playing field. We were being drawn onto this playing field of you guys, you people who don't want the restrictions have to prove that they won't work first before we get rid of them. Right? So it was like, we have to fight about the science. And then if you can win the battle of the science, then we can talk about easing the restrictions, or then we can talk about not having vaccine mandates. But that's the argument that we were drawn into trying to win. But if you look at how science works, it's an unwinnable argument, right?
Of course.
There's this idea, this precautionary principle, i.e., well, if you think that something's going to be really risky, well, you do everything you can to mitigate it, right? And that was the argument of the kind of the hyper COVIDians, like, oh, we have to have social distancing, we have to shut down all the businesses, we have to mask mandate, we have to do this because it might help us, so we have to do it all. But to me, again, there's this principle, this fundamental civil liberties principle, that you don't even have to get into the science. You just say, I don't care what the science says. You can't force me to do that. It's wrong. We can't live in a society where you can force me to do X, Y, or Z because you say that it will save lives. Like, you could maybe prove that if we take everybody with HIV and we take them and shoot them and bury them in a mass grave, we'll save lives in the long run because, well, all the HIV will be gone if we do that.
Yeah, that sounds profoundly evil, though.
Yeah, right. So that's the thing. Well, it may very well save lives, but you've done this immense harm to people. And with locking people up, shutting down their businesses, not letting people visit their grandmothers, we did these immense harms to people. And we kind of argued that the harms were okay because, we're doing it to save lives. Well, yes, but you're doing harm and you're violating people's fundamental civil liberties. And we just can't ever, as a society, let ourselves cross that Rubicon again.
I 100% agree. Like old people being forced to die alone without their families. We've all seen the photos of, you know what I mean, like a sad-looking old lady, like, holding up her hand to her daughter against the window. Like, imagine being a child with autism, just at that crucial age where you like hearing and speech therapy is so important, and then having that shut down for 6 months and then having to do it a year and a half over Zoom. Like, it's inexcusable.
It is. It is. I saw it too, as both of the scenarios you're talking about. I saw them play out in real time in my family practice and in the Emerge when I was still working in the Emerge. I saw some terrible, terrible things and inexcusable things, and it made me embarrassed to be part of the medical profession that was part of that.
Yeah. That actually, it's a good segue into one of my questions. So back to your time in Emerge, like, back before you, honestly, man, did the right thing and spoke your truth. Back to the emergency rooms, though. Do you feel that there was ever, like, we all know the healthcare system in this entire country is, pardon my French, but it's fucked. And in Nova Scotia, it's really bad. It's terrible. But like, we are at the, like, even on a non-flu season, we're at the breaking point. You know what I mean? Like, people don't have family doctors, they're going to the emergency room for basic things, and like, you could be in a lot of pain waiting 6 to 12 hours there sometimes. Do you feel like during the shutdown there was ever, like, were we ever overloaded during COVID?
No, and in fact, so I look back at it and I'm kind of, it's embarrassing for me to tell this to people, but so I was head of Emerge for the area, and people knew that in my community in Sydney. And a lot of people knew who I was because I was on the radio and I was active around town with a lot of different clubs and whatnot. And, there was that time when everybody's you couldn't do very much. So people go for walks, but you'd social distance. Like, you go walking down the sidewalk, somebody walk towards you and they walk way out around you. I don't know if you experience this. My wife and I would go on these long walks because there wasn't much else to do. And so people knew I was the head of Emerge. So I'd be out walking and somebody would be coming down the sidewalk with their mask on. They'd walk way out around on the road and they'd wave at me and say, "You guys are healthcare heroes. Thank you so much." And this would be like, say, I don't know, September of 2020. And I was kind of like, "Oh, thank you." And after a while, after about the fourth, fifth time it happened, I would tell people, I'd say, "Look, just so you know, the emergency room's empty. We're not working hard. We're actually bored." We were literally thumb wrestling for the next patient because it was so quiet. Our volumes at one point went down to about 35% of normal. We didn't have anybody in who was sick. Nobody wanted to come because they were all terrified. So people would have their chest pain or whatever at home, and it would either go away or wouldn't. We had more deaths at home because people probably died of heart attacks and that and strokes because they didn't want to come in because they would catch COVID, God forbid. And so our emergency rooms, it was the quietest ever was. You could have shot a cannon down the main hall of the Cape Breton Regional Hospital and killed no one because no one was there. The hallways were empty. The emergency room was empty. The beds had been emptied out. We had sent people home. We had sent people to nursing homes. We got all the beds empty. And the best description I heard of it was like back in a medieval castle, and you hear that the barbarians are going to attack. And so you get the boiling oil ready on the ramparts, and you've made all your arrows, and you got your quivers full, and you got all your blades sharpened, and you're all standing there. And then the next day you're standing there, and the next day you're standing there, and the barbarians won't come, but you're all like ready, but there's no barbarians. And that was what it was. And even during the height of COVID, rather, in Nova Scotia, they made big deals about publishing the COVID numbers. Oh my God, we have this many patients in the hospital. But what people don't realize is that those patients tested positive for COVID, but they weren't necessarily COVID patients. Like somebody could break their leg, come in, they get automatically swabbed to see if they have COVID. Oh my God, you're COVID positive, so now you're a COVID patient. So when the COVID numbers were published, they looked quite significant at times, but they weren't, because most of those patients weren't patients who were in because of COVID. They had incidental positive swabs for COVID. And I could go into a bit of the detail if you want on why those swabs didn't actually mean very much, but they didn't. It just meant that you had some trace of COVID in your nose. Just didn't mean that you were sick from COVID or you could pass it on or anything. But we defined them as COVID patients, and we listed them as COVID patients. And Dr. Strang got to go up there and tell everybody stay the blazes home and this is an emergency, but it really wasn't. And any healthcare worker who tries to act like they were a hero in Nova Scotia during COVID is full of shit.
Yeah, totally, man. And like back to the testing thing and just like the sheer numbers of people who just had COVID, they were in the hospital, and it was just assumed that, they're in the ICU on death's door because of COVID. It just goes to show you, like, just how their narrative falls apart. Again, I mean, like, they would just make things up depending on like what narrative it would suit. Before the vaccine was available, we were all told that we had to be terrified of COVID because, people my age, you're going to be asymptomatic, you're going to have it, you're going to spread it. But when the vaccine rolled around, all of a sudden I needed to get this thing because it was the most deadly disease ever. And it's just like, okay, so which is it? You need to pick one. Like, am I going to be asymptomatic and not even know I have it? Or, like, is this the most deadly thing and I need to take this experimental shot for? Like, yeah. It's like, I'm over a lot of this stuff. I've let go a lot of my, like, hostility, but, like, even talking about this stuff just gets me all fired up, man. Like,
well, I've learned to. I've been pretty good at this through my life. I guess you have to be to survive 20 some years and emerge, 23 years or whatever I worked to emerge. But I'm pretty good at laughing at things, and I think you have to laugh at the absurdity of it. It's important to be angry enough to care and to do something, but it's easy to get wrapped up in anger and hatred, and that doesn't really do you any good in the long term. All it does, it shortens your lifespan. It's not going to hurt your enemies, but it'll hurt you. So, I like that biblical injunction that we forgive not for the sake of the other, but for our own self. And I think it is important. Forgive but not forget. I will not trust these people again. As a Christian, I forgive them. I move on with my life. I don't hold that anger inside me and wreck myself. But on the other hand, am I going to just trust them again the next time one of these things rolls around? No, I'm going to be even more skeptical than I was this time.
Yeah, that's very true, man. And as for but what you said about like if something like this ever happens again, do you feel like public health has sort of like really discredited itself on this and not done themselves any favors? Like I honestly think like there's like if something happened, like let's say some sort of weird new Ebola strain that like actually has a fatality rate of like 60 to 90% or something just comes rolling through. How many people who otherwise would have taken it seriously would just be like, come on, you know what I mean? Like,
yeah. So my take on it, so it's interesting. I've had this conversation a lot over the last few years because we're 5 years now after the COVID thing. So there's a lot of time in retrospect. Some people are still in COVID mode, but most of us are in retrospective mode now. And my take on it is there's a lot of people I've heard, even people on my side of the COVID divide, who say things like, oh, it's terrible that public health has discredited itself because now people look at the rates of vaccination have really gone down for other things, and that's a sad thing. And to me, I look at it, I call it the great medical awakening. I think it's wonderful. The lack of people realize that the whole approach of public health with COVID was absurd, or many people do, and now they're looking skeptically at all these things. Do I really need a flu shot? Does my kid really need to be vaccinated for Hep B when they're
Hep B, yes. Thank
6 hours? Yeah, do I need my kid poked with the vaccine when they're 6 hours old for Hep B, which is a disease?
Which is something you get from needle drugs and unprotected sex. Why are we giving that to babies?
It's a disease of hookers and drug addicts. It's like how do you possibly know that my 6-hour-old baby is going to be a hooker or a prostitute? Get away from them with this vaccine. So people are starting to get appropriately skeptical. I'll tell you my story on vaccines. I was a good boy when I first graduated med school, and I kind of just believed most of what public health told me. But I was always one of those people I was always a bit skeptical of the establishment and big pharma. And I looked at vaccines. I realized vaccines are a big pharma. We don't like to think of them, but big pharma, just like they sold OxyContin, they sell vaccines. And so I was skeptical way back when chickenpox vaccine became standard in Canada around 2000, I think it was 2001. And people don't know this, but it's not really standard anywhere else in the world. In Europe, in Australia, and New Zealand, We give chickenpox vaccine to kids who are on chemo or have some kind of genetic immune disease or something. We don't give it to every healthy kid because it's just chickenpox and you get it and then you're immune for life. So, just let kids get it, let their immune system deal with it naturally. In Canada, we put it on the schedule, and I was very skeptical at the time. I remember reading about it and thinking, this is weird. Like, why are we giving this to every kid? And then the Gardasil, the one for HPV, that theoretically is going to prevent cervical cancer down the line.
It gave a lot of people cervical cancer in the trials, didn't it? Is that what happened?
No, it didn't. And I'll tell you why it didn't, because we don't really know, because there's a 15, 20, 30-year lag time. You get HPV when you're young. We think that it potentiates cervical cancers by the time, and you might get HPV contracted when you first have sex. You're 18 or 17 or 20 or whatever. And then you get cervical cancer when you're 45 or 50. So we couldn't tell from the trials. It was basically this theoretical thing that would happen. Oh, if we can get rid of the HPV, we'll reduce cervical cancer. But we didn't know that. And I also thought this shouldn't be standard. This is a theory. We don't know how safe it is. We don't know how effective it is. How can we be promoting this like, oh, every kid should get it? We don't know that yet. And then the other thing I became skeptical about in the 2010s was we went from giving kids like a vaccine every once in a while to like, oh my God, now you come in, you get 4 vaccines when you're 6 months. You get, I can't remember the exact schedule. You get 5 vaccines when you're 1 year, and you get 4 vaccines again when you're 18 months. And we're giving kids multiple needles multiple times. I was like, this just seems like too much. Like, I maybe it makes sense. Smallpox vaccine. Smallpox killed tons of people, and from what I understand, the vaccine was very effective. Smallpox doesn't mutate year by year, so you vaccinate for it and you're immune for life, and that made sense. But then we get into things like, I say, chickenpox and Gardasil and vaccinating for flu and all these things. And after a while, it's like, are we overloading the immune system with vaccines? Are vaccines really, is getting a flu vaccine every year, is that as effective as getting the flu every few years? Does it give you as good immunity, as long-lasting immunity? Is it harmful for your immune system? We should have been more skeptical about these things. And now that public health really blew its credibility on COVID, now I think more people can be like I was for a lot of years, saying, do we really need all these vaccines? Is this good? And thank God for RFK Jr.
Yeah, I was going to say, it's funny, I was doing a little... I was just like reading some of your work. I was going through like your Substack and stuff, but I was like, I listened to like your interview with Gad Sad, and like I follow RFK, but I had no idea you were on his podcast. That is so cool. Did he reach out to you?
He did. His he didn't specifically. He has people.
Yeah.
He's important enough to have people. So one of his people reached out to me, and so I got a chance, about 10 minutes pre-interview and 5 minutes post-interview to kind of chat with them more generally, and then the actual interview that you'd hear. So it was a very interesting experience. He's a very intense guy. I like him a lot. I don't agree with 100% of what he says, but geez, I don't agree with 100% of what I say. I look back at things I said over the years, and I think I was probably wrong in this or that. So I love his approach. He's not outlawing vaccines. He's just saying, hey, we need to really look at these things and really look into the science and see what advice we can provide to people. And so I think it's a perfect approach, and I'm very happy to see it.
Yeah, it's awesome. It was I don't know, were you following his his Senate hearing confirmations? That was absolutely wild to watch. Like, he was just up there, like, I don't want to mock his voice. Like, I know he's got like the whole thing, but he was just up there saying like, well, look guys, like I'm not saying I want to outlaw your vaccines. Like, I just think they should be tested. They should go through clinical trials like other medication. And like, just to watch like Elizabeth Warren and Bernie Sanders, who's supposed to be against these evil companies, just go at them. That was so disappointing to watch, because like, I don't know, there was a time when like I was rooting for Bernie, you know what I mean? And just to watch him just be exposed as not so anti-establishment is just really disappointing. And it's really strange I don't want to segue, like, I brought you on here to talk about COVID, but like, it's so interesting to watch the United States right now, because like it just seems like it's just weird to watch the new hippies be on the right, like when it comes to being like against evil corporations and and being anti-war.
Yes, you know what's interesting? Something you kind of ran over there. So I have been I was never a Bernie bro because I have part of my family tree goes back to the Ukraine, and so I've read enough about communism to be very anti-socialist and anti-communist for a long time now.
Fair enough.
And but by that nature, what people are realizing now, and I'm smiling about it because I knew that Elizabeth Warren and Bernie Sanders were full of shit for a long time because they talk big, but they call them, there's a name for it, they call them Volvo socialists or BMW socialists. Like they rich people with the Rolex on, they drive up in their nice car and then
or a Maserati socialist.
I'm for, yeah, exactly. I'm for the little guy. But when you look at who wants the government to take over healthcare the most, it's big pharma, it's big industry, it's big healthcare, because once healthcare becomes free, then people just use it like crazy. You know what I mean? Like, why would you not want all kinds of tests and all kinds of pills if it's all free? So when you look at who is lobbying the hardest for the government to take over healthcare and be the one to fund healthcare, behind the scenes, it's big pharma. And that's why people may know this, but Bernie Sanders and Elizabeth Warren, I can't remember who is the third, are the top three senators in terms of their funding from big pharma, right? And they have been for a long time. So Bernie, who's like, oh, healthcare should be free for the people, blah, blah, blah. He's big pharma is behind him, pushing him. Yeah, Bernie, go, yeah. Because once it's free, they're going to do great. They're going to do absolutely great. So people don't realize that. I think the worst thing for healthcare is for the government to fund it and to administer it. It just doesn't work, and we're seeing that in Canada. It's just Canada. We think it's the government of the day, and we shout and scream and say, "Oh, the government's got to do something." And Tim Houston says, "I'm going to fix healthcare," and the government forum said, "I'm going to fix healthcare," and everybody said, "I'm going to fix healthcare." But when you look at healthcare in Canada, it's been on a downhill slide ever since the government took over healthcare in the late 1960s. It's been on this just a steady downhill slide. Doesn't matter, conservative, NDP, liberal governments, healthcare just goes downhill because it can't be free. It's not free. It costs a lot of money. And when the actual user of the healthcare doesn't have to pay for it, they just want as much as they can get. When doctors feel like they're underpaid, they just scream at the government for more money. So you have the consumers of healthcare, you have the providers of healthcare screaming at the government to pay more. The government just represents us. So we're not going to vote in a government that says, look, this is too expensive, we can't fund this anymore. We're going to say, I'm not voting for you. I'm going to vote for the guy who's saying he's going to spend more money on healthcare, right? And then we all complain that our tax bills are so high and that healthcare is all messed up. But it's all inevitable when the government runs it. So I tell the Americans I meet who talk about, I wish we had a healthcare system like you guys in Canada. I slap my knee and I say, you come up and you try it for a year, and you will go running back to America and say, please don't change our healthcare system. Oh my God, please don't change our healthcare system.
Yeah, it's a complicated issue though. I'm open to that perspective, but like at the same time, what do you do about the because people aren't doing so great in Canada right now. You know what I mean? Like if you just took like a lot of people and you just all of a sudden you just flipped a switch and we had the reality that like Americans lived with, a lot of people wouldn't be able to afford that insurance. And like, what do they do?
Well, it's an interesting thing, and the answer to it is long. The first thing I'll say is I recommend highly, if you're interested in this subject, get a book by a guy called Sean Whatley, Whatley. It's called When Politics Comes Before Patience, I think is the name of the book. But if you look at SeanWhatley.com, SHAWN and WHATLEY, SeanWhatley.com. And basically it goes through this, there's this idea, and Tommy Douglas, who was the one who kind of foisted universal healthcare on Canada and made it part of our national identity. He gave the impression that prior to the government paying for healthcare, there were all these people who died in the streets because they couldn't get healthcare. And that is not true at all. And Sean Watley kind of busts that myth in the first part of his book. Because the actual story is doctors always took care of what we call indigent patients. If you were poor and your appendix had ruptured and you need an operation, they didn't say, yeah, you can die. I don't care. They took your appendix out, right? And they worried about getting paid. Maybe you gave them some eggs for the next year. You give them some eggs if your chickens laid some eggs. And the doctor was satisfied with that. But most people can pay. And so what we've gotten trapped in Canada is this thinking that you can't do anything to fix the system because 2% of the population might be inconvenienced. And I say, well, what about the other 98%, right? We forget that the vast majority of people aren't so poor that they couldn't afford to pay for healthcare. They could manage it. And so we screw it up, and the government has a monopoly on healthcare. You can't buy healthcare. You get put on a 6-month wait list for your MRI scan with this cancer that's growing fairly quickly. Guess what? Too friggin' bad. You can't go. And
there are a lot of people that go to the U.S. if they can afford it. Well, I'll tell you, the reason I push back on this topic a little bit is, honestly, man, I'm a little bit closer to the 2%. I think if I had to pay for a major surgery or something, or God forbid something for one of my kids, it would be a decision of how are we going to pay for this? Are we going to have to get a line of credit or something? But I'll tell you this, well, this is kind of gross, but a couple of years ago I had an MRSA infection. Mm-hmm. Oddly enough, it was within a year of me getting the shot. But anyway, it was also after my daughter was born. I stayed at the IWK, so that's obviously where I picked it up. My immune system couldn't deal with it, and I went to the Emerge. I lost count of how many times, and my brother's wife is actually a nurse. And she was just like, that is MRSA. I was on vacation when she saw that. She's like, you need IV antibiotics. You need serious help for that. And I would go to the emergency with this pain, and I would tell the doctors, and they would just be like, no, it's not. Blah, blah, blah. Here's some oral antibiotics that don't work. Get out of here. And I did that so many times. And I just remember thinking, if I could just max out my credit card to get a doctor that will listen to me, I would do that.
Well, here I'll throw in another perspective here too that people forget in Canada. I actually had this conversation with a friend of mine he was a pretty healthy guy until he was about 46 or something, and then he found out he had a brain tumor and he needed complicated neurosurgery, and he was in hospital for a couple of weeks and all that. And he said, "Oh my God, thank God I was in Canada and not the U.S. because otherwise I would have been broke because of these healthcare fees." And I said to him, and he's a high income earner, right? He's a guy who probably makes 180 grand a year. And he had been making good money since he was in his early 20s. And so say he'd been paying taxes for 25 years by the time he had the operation. I said, how much of your tax bill do you think goes to healthcare, right? Because when you look at it in Canada, it's about, I think the number now is around $9,000 per person per year. But then you have to say, well, lots of people don't pay tax. So when you pay the healthcare portion of your tax for a taxpayer, you're paying for yourself and for somebody else. And so then you have to say, well, this guy was maybe paying $18,000, $20,000, $25,000, $30,000 per year towards healthcare between him and his wife for 20 some years. And you do the math on, if he had been able to keep that money and put it in an account with interest, he would have had $1 million. And the operation and the hospital stay he had weren't nearly $1 million thing. Maybe 50 to 100,000. And yet he's there oh my God, thank God I'm in Canada and I didn't have to pay for this and it was free. It's dude, it wasn't free.
Oh yeah.
You paid a ton of money for that privilege of shitty healthcare, and it was kind of shitty. He had to wait a long time to see the neurosurgeon. His hospital stay was pretty shitty. He was in a wardroom. The food was terrible. The whole experience was bad. But he probably paid $1 million for it. You know what I mean? Over the years. So we think it's free. We think that people somehow won't get healthcare when they need it, and none of that is actually true. None of it's true. I'll throw out a little tidbit to you here. In Canada, we have 10 times as many healthcare managers per capita as in a country like Germany. So in Canada, about 1 in 1,500 people identifies as, what's your job? Oh, I'm a healthcare manager. They have a degree in healthcare management or something, and they tell doctors and nurses how to do their job.
So is this literally the thing from Office Space then, where he's just like, I have 8 different bosses? Like,
yes. So
damn.
in Nova Scotia, I could show you I actually wrote about it in one of my Substacks, but I included a picture of the org chart, like the chain of command in like the chain of command in Nova Scotia Health. You would need a degree in in higher level nuclear physics to be able to understand the org chart, because it's so complicated. There's so many levels. Whenever I want to deal with a problem at the hospital level in my little hospital, I'm not allowed to talk to the person who can actually say yes or no. Hey, we'd like to stock a certain drug. Okay, well, you have to have a meeting with these people. Well, can they say yes or no? No, they can't. Well, can the person above them can't? No, they can't. So I'm only allowed to deal with the level 1 person, and it might have to go to level 6 before they say yes or no. And by the time it's gone to level 6, they have no idea what I was talking about, because it's gone through 5 different sets of people. And then they'll usually say, well, no, we're not allowed to do it because of this. Well, did you understand my reasons why I was asking? Well, probably they didn't. So the whole system is just so bureaucratic. There's a name for it in communist systems. They call these people apparatchiks.
Apparatchiks?
Apparatchiks, yeah, APPARATCHIK, apparatchiks. And what these people are is they're a manager or they're a middleman, but they don't actually serve any real function. The position is there more to give somebody a job. And so it has a job. It has a job title. It has a nice salary. But if that person fell off a cliff tomorrow, the whole system would function exactly the same as it did before, because they serve no useful function. And we have thousands and thousands of those in the Nova Scotia healthcare system, pulling in $70,000, $80,000, $150,000 a year, and they're called a manager, but they don't actually manage anything, because by definition, a manager would have to make decisions on things. These people don't make any decisions. They're not allowed. They're not empowered to make decisions. All they do is they collect a salary, and they get in the way of people like me actually talking to somebody who could make a decision.
Wow. That's crazy, man.
It's because it's the government, right? Like, the government departments, one of the things that anybody who's worked for the government will know is that you'll get these memos. It's, whatever your year-end financial is March 31st, and you get a memo on the 18th of March saying, oh, by the way, we're buying a new computer. And you could say, well, I don't really need one. Oh, we need to spend all our budget before the end of the year.
So
right?
Tim Houston he campaigned on fixing the healthcare system, right? So has anybody run this by him? Because that could be a way to fix it, right? Is maybe cutting out some of these apparatchiks.
Yep. Tim Houston has added way more managers. So in my little area, my little corner of Nova Scotia alone, just in the time that I've been there, the last few years since Tim Houston started, we have like 4 more managers, and they usually are nurses. Typically, these people are nurses, and so they take a nurse who's working in the hospital and maybe frustrated working in the hospital, partly because of all the apparatchiks, and she doesn't want to work there anymore. And then they make her an apparatchik, and they say, "Oh, well, we'll make you the manager of primary care for the this section of the zone." And then you kind of look at what they do, and they're trying to find work to do, because they don't really. There's no like set of deliverables. Let's say there's nothing like what are you supposed to do by the end of this year? Well, I don't know. I'm supposed to manage things. Well, what are you going to do? Well, I don't know. Well, what can you actually tell me yes or no on this funding question or this organization question? Oh no, I'd have to go to the level above me. So they basically get taken away from the front lines. Then we say there's a nursing shortage, but we have hundreds or even thousands of nurses in Nova Scotia who are apparatchiks, who carry clipboards around. We call them clipboard nurses because they don't actually look after patients. They carry clipboard around. They note things, and they'll make sure that your spreadsheet was filled out in full and all these things. They basically make the job of the frontline people harder because they make more hoops for us to jump through. So a typical nursing job, I talked to one of my favorite nurses. She's probably almost 40 years into her career. And she said that at the beginning of her career, she spent about 20% of the time doing paperwork and 80% of the time with patients. Now it's 80% of the time doing paperwork, i.e. punching things into computers, and 20% of the time with patients. Your patient poops in his diaper and you have to go and change it, and you do all that, and then you come back and you have to do these spreadsheets. What did the poop look like? Was it brown? Was it black? And you have to go through all these spreadsheets. And that's just for a poop, let alone, God forbid, giving medication or something. And there's even more spreadsheets and things to fill out and forms to print and tick off and whatnot. So there's not a nursing shortage. We have more nurses than we ever did. We have more doctors than we did 20 years ago.
They're just so overwhelmed with menial tasks, basically.
We are, and part of the doctor shortage, the perceived doctor shortage, we're overwhelmed with paperwork and menial, useless things that the apparatchiks make us do. But also, doctors aren't as invested in their careers anymore. A lot of doctors work half time. They gravitate towards jobs where they do as little as possible. Partly because it's very frustrating. They feel like they're not independent. Like they got to, everything they do is by checklists, and you got to do this and this and this, and make sure you ticked off that box, that box, and that box. It's sort of like you feel like a worker on an assembly line rather than an actual doctor who's just trying to look after patients.
Wow. I have a couple more like COVID related questions just in your healthcare experience. So like when you mentioned the doctor and nurse shortage, so like when the mandates kicked in, as we know, like there was not a lot of people, but more people should have been asking the question of like, well, we have this like shortage, you know, we've got long waits in the ER. Why are we letting go nurses who, you know, they didn't want to get the shot? They probably already had COVID, to be honest, like if they've been working in the hospital this entire time. And I would always hear from people like that would defend this nonsense. They would say like, oh, well, we don't need healthcare workers that don't want to get the vaccine. And like, there aren't that many of them anyways. Is that true? Like, were there a lot of people that were booted from the healthcare system for not taking the shot?
I think I think I have a good answer to that. The answer is we'll never really know. There's an official number who were terminated because they refused the vaccine. But that official number, which is relatively small, it's only a small percentage of nurses, doesn't tell the story at all, because most nurses managed to do, there's a number of things happen. A number of nurses who were kind of nearing retirement said, screw this, I don't want that vaccine. And if I stay on, I'm just going to get terminated. So I'm just going to take my pension and go. And I know a lot of those nurses, they were going to work another 5 years, another 10 years, another 15 years. And they just said, screw this. So that these early retirements were part of it. I know nurses who took whatever they could get, some severance or some pension or whatever, and went off and just switched career if they were young. I know nurses who wriggled and jiggled and managed to get off on stress leave or whatever, and so that they weren't subject to the vaccine mandates if they were on stress leave, and so they were getting their disability payments if their back got too sore or they were on stress leave or whatever. So some managed to get out that way. So there was this rash of disability that happened, and that was related. So all of that was actually mandate-driven removal of nurses from the system. It was especially nurses. Doctors were much more compliant. I can only tell you a handful of doctors who were affected. Most doctors just said, oh, vaccines are all great and I'll just take mine. It was really disappointing. So I don't think it affected a whole lot of docs, but nurses for sure, we lost staff, definitely.
Wow. Yeah. And like back to the RFK thing, like how awesome it is that he is, you know, he's the Director of Health and Human Services of the United States now. And you mentioned Jay Bhattacharya. I love that you know that name. Like, as you know, he co-authored the Great Barrington Declaration. I don't think he's been confirmed yet. He's going to be is it the head of the NIH? Like literally Fauci's old job?
Yes, he is. It's the ultimate karmic moment in my whole life. I've never seen karma like this. So Fauci, who tried to get rid of Jay Bhattacharya and tried to besmirch his reputation and, you know, sent all these horrible emails that he thought would be private and came out. And now Jay Bhattacharya is going to actually have his job. So Jay is, I would call him a friend. people may or may not know, but Jay, when we did our first free speech and medicine conference here in Nova Scotia, in Badek, Jay flew all the way from California.
Wow.
And gave a talk for us, spent 2 nights. He gave this amazing talk. He's out of all the people I've ever met in my life, he's one of the most amazingly calm, wonderful man. He managed to laugh about everything that had happened. He wasn't bitter. He wasn't nasty. He doesn't hate Fauci. He knew it was wrong. He saw the wrongness in it, but he doesn't hate. And anyway, he was such an amazing man. And the other thing I should tell people, because I don't think many people know this, we normally, with our speakers, we give them a kind of an honorarium, a stipend, because they're taking often 3 days at a time, 4 days at a time. They fly all the way out to Nova Scotia. They kind of stay in a hotel. And so we give them something for that. When we went to pay Jay, he said, "No, thank you. I really appreciate you offering, but I don't take any money for any of my speaking engagements." And I was like, "Oh, what? Really?" Like, I felt bad because he spent a whole weekend away from his family. And he said, "No," he said, I don't want to ever feel like I might be doing it because I'm getting paid for it. So he said, "I've never taken a cent for my speaking on COVID, and I never will take a cent for my speaking on COVID. I just don't." He's such an amazing guy. He's not about the money. He's about what's right and wrong. And just, oh my God, he's just a shining star.
That's fantastic, man, that you actually met him. That is really cool. Have you ever read, there's a book called, it's by, he's a libertarian podcaster. His name's Tom Woods. The book is called Diary of a Psychosis. Yeah. Honestly, normally it would, my book would be right here, but it's upstairs. But I would show it to the camera and I would promote it. But he wrote the foreword to that book, and it's probably the best 2 pages on the subject. You could, he summarizes it so well.
Yeah, he really is amazing, and he's just, one of the reasons he's amazing is he doesn't get angry, and he doesn't let anger cloud his judgment, and he maintains his scientific objectivity about every topic. Going back to what I said, he has a very nuanced view of the vaccines and how dangerous they were and how useful they were. A lot of people on our side of the COVID divide have tended, I think, our anger can make us prone to what we call confirmation bias, right? You are so angry that they made these vaccine mandates that you say any article that says that the vaccines are dangerous, you're going to believe it. And any article that says they're safe, you're not going to believe it just because you're angry. And I struggle not to fall into that. Jay just doesn't do that because he's not angry. He just looks at it and says, "Well, here's what I see the science saying," and he very objective about it. So that's hard to do. Not many humans can do that.
Yeah, absolutely. I mean, I appreciate that perspective because, if you look at the data and you follow the deaths, there was a dip in deaths once we started getting people vaccinated. But as you saw at the start of the pandemic, there was we had, I don't mean to disparage the people that died and their families, but we were going on a whole year where we were under 70 and it was all at Northwood. You know what I mean? I just feel like Jay had the right approach from the beginning because the Great Barrington Declaration, he wrote that was it the summer or the fall of 2020?
Would have been the late, in the fall of 2020, I think.
Yeah, fall of 2020. So he had the right approach to begin with. He was never trying to minimize the virus, especially in that first year, but he was simply saying that the harms of locking everybody down and what we were doing outweighed the benefits. Mm-hmm. You know what I mean?
He was very good on that from the beginning. You mentioned
we could have protected all these vulnerable people while not making children sacrifice. And
yes, I'll tell you my one problem not with the Great Barrington Declaration itself, but how it was interpreted. There's a couple of things that spring to mind that are worth telling you about. So firstly, we talk about protecting the vulnerable people. When we talk about the vulnerable people, like we talk about stray cats or endangered birds, and we forget that the vulnerable people are people.
Of course.
Yes, there are elderly people who have dementia and they can't make decisions for themselves. But the vast majority of people who are vulnerable were sentient beings who could look at their own risk benefit ratios with things like, do I want to lock myself down and not see my grandkids again?
Of course. Yeah.
So for instance, my mom was a vulnerable person. She was just about 80 when the pandemic hit, and she had a chronic cancer for which she was on chemo. So she was one of these very high risk people. And for the first month, when they said, oh, we're going to lock down for 2 weeks to flatten the curve, my mom was kind of stressed out, and she was like, I think I should probably be, not be around people too much. When I was like, okay, Mom. After about 3 or 4 weeks, my mom was a very social person. And after about 3 or 4 weeks, everything was shut down. None of her seniors events were happening. She, hadn't seen the family much and whatnot. And I talked to her about things. She said, you know what? She said, I don't know. I might not live that much longer anyway with my cancer. And she said, I thought it was going to be a few weeks, but this looks like they might lock us up for a long time. She said, I just don't want to do that. I'd rather take my chances. And, if I get really sick and die, I get really sick and die. I've already said I don't want to be on a ventilator. I don't want life support and all that. So if I get sick and die, I'm okay with that. And Mom started to be a lot more social after that. And for the last 6 months, year of her life, she had pretty good quality life. We went and did this and that, and we snuck out and had parties. And when she had her 80th birthday, we all went over and had a cake and all that. So she kind of dropped the social distancing. So that was the one thing that Great Barrington Declaration, we talked about protecting the vulnerable. Let's make rules to protect the vulnerable. We should have asked the vulnerable. That was one thing. The other point
it's my understanding that it was predicated on being voluntary, right? Like, I don't think he was ever...
But what I'd say is I don't think that was written carefully into it. So a lot of people took it as, well, it's not okay to lock down young people, but it is okay to lock down old people. And I think my one criticism of Jay and Sinatra and Martin on that was they should have been more clear that, look, this should all be voluntary. We shouldn't lock anybody down against their will, but maybe the older people should take more care because they're higher risk, but that would be up to them, right? Going back to the other thing, you mentioned Northwood. So Northwood's interesting. When the public health had people so panicked about COVID that, and I saw this in people I worked with, when COVID came around, all of a sudden a lot of staff would call in, I'm sick, can't come in. Because they were terrified. They thought you'd have a 30-year-old CCA, one of the ones who has to feed the old demented people, or the old frail people in the nursing home, and she would be terrified that she was going to die COVID if she caught it from the old person. So she'd call up and say, oh, I think I'm sick and whatever. Some people even lied, said I had a positive COVID test, I can't come in, so that they didn't come in. And so Northwood was working very short-staffed. And one of the nurses I have great respect for, who worked there right through the pandemic, even though she's older herself, she never missed a day. She told me that she would come in for evening shift, and she would look, and there would be 3 meals sitting outside a patient's room. And it might be a patient who was immobilized and in bed. They couldn't get up and get their meals. There was no family there to give them the meals. There's no family there to notice they weren't getting the meals. And these people were getting progressively dehydrated and isolated, and their diapers were going unchanged. And so there was a study done in France that showed that all of these nursing homes where so many people died of COVID, even just going in and making sure the patients got fed and got enough water and fluids, decreased the mortality by about 50%. So it's very likely in my mind that half of those people who died at Northwood probably died more of neglect than they did of COVID.
3 meals sitting outside somebody's door.
Yeah, and the drinks on it too. So these old people might have been sitting there all day, and because they had COVID or they had a cough and people thought they had COVID, the staff was so terrified of COVID that they just didn't go in. You may have read about the nursing home in Quebec where they had to send in the military because the staff had basically abandoned these people, and they went in and they found people dead, lying in their beds, dead, probably more of dehydration in some cases than of actually COVID. Maybe they had COVID. But the COVID, just if they had got enough to eat and drink, like if somebody gets the flu and you don't give them anything to eat or drink, they're going to die. But it's not necessarily the flu that killed them. It's the fact that you abandoned them, right? And so I do think, don't get me wrong, I do think that people died of COVID. I just think those numbers were very, very small and confined to very frail elderly people. And there's a lot of these people, even the nursing home patients, a lot of them could have made it through with proper care.
Wow, that's heavy, man. And it's like, I want to touch on something you said right at the start. I jotted it down really quick, and we didn't get there. But when you said earlier, when we were talking about children and the school shutdowns, you said no healthy child in Nova Scotia has died of COVID. But do you remember when we did have a child die with COVID, and it was politicized by Tim Houston? They couldn't wait. They didn't even wait a day. They got in front of the news cameras and they said a child has died of COVID. Like, stay home, stay safe. And like, it wasn't even 12 hours later before the family of that child came out on social media and they had said, like, well, no, like, look, like, what happened to our kid is a tragedy, and like, it's disgusting that it's being politicized by either side. By the way, because there are people trying to say that the kid was vaccinated and he died of side effects, and the province was saying he died of COVID, and you know what I mean? Like, it was just,
yes,
it was what it was.
And my understanding, and this is not, I'm not disclosing anything I shouldn't as a doctor, because he wasn't my patient. I'm just going by what I think was his aunt had posted on social media. But this was a very handicapped child who was only expected to live until the age of 10 or 11, and he'd already lived 3 or 4 more years than they thought he would get. And he finally passed away of complications of his severe genetic anomalies. And so this had really nothing to do with COVID. He had a positive COVID test, but it was his time. You know, God had decided that was his time. And really, just to expand what I said, I didn't say no healthy kid in Nova Scotia died of COVID. No healthy kid in Canada died of COVID. There wasn't one.
Yeah.
The closest that we came was there was a kid in Toronto who was severely obese, didn't officially have any other health problems, but was severely obese kid. And there were also problems with, like, I think her father didn't recognize how ill she was and let her get very dehydrated at home. So in all likelihood, with proper medical care, she just would have got some IV fluids and gotten through it all right. So that's the closest we came to a healthy child, was this severely obese child who was kind of neglected or passed off by her father, who didn't recognize her illness. But otherwise, all of the kids who died of COVID had severe genetic abnormalities, or they were on chemo, like the kid with the brain tumor in Alberta that they tried to politicize, and the family got angry because they said he didn't die of COVID, he died of a brain tumor. Stop saying that. Over and over again. We only had a few dozen kids in total over 5 years die of COVID, and most of them had severe comorbidities. So they can't really say that no healthy kid died of COVID. It just doesn't do that. Yeah.
And back to the obesity thing too. You know, that was known early on. I remember reading that it was probably the spring of 2020. Like, that was a common fact. And they were telling people, they were closing walking trails and telling you not to go to the beach, when, like, really the advice should have been, check your BMI. Like, if you're obese, like, this is, like, you know, but we don't say that. We're afraid. You know what I mean? Like, because you don't want to offend somebody. Well, you don't want to fat shame or whatever.
Yes, it was a really unfortunate thing that it rather than empowering people and giving them confidence and saying, look, if you're reasonably healthy, your odds of dying from this. The statistics were, if you were under the age of 75 in Canada, your odds of dying in a car accident were significantly higher than your odds of dying of COVID, right? And if you told people that, people would say, oh, okay, well, that's not so bad, right? And we could have told people that and said, you can lower your risk by getting in good shape, quit smoking, you know, don't do drugs, you know, get some exercise, get some vitamin D, whatever. But instead, what we did was say, COVID is a risk to everyone in the community, and be afraid, lock down, stay away from people, shut down the gyms, don't go out and walk in the park. We did everything we could. You know, the rates of alcoholism went way up, the rates of eating shitty food, the rates of obesity went up significantly. All of these policies actually made people less healthy, but it's because we made them terrified instead of empowered, right? And public health is supposed to be about empowering people, giving them the information that they need to keep themselves healthy. It's not supposed to be about we're your nanny, we're the big nanny state, and we're going to tell you what to do, and we will keep you safe, but you can't do anything for yourself because you're too stupid. We'll do it for you. That's what it became during COVID. It was never, public health was never supposed to be that.
Exactly, and that's I want to start wrapping up here pretty soon, but I want to get that's a perfect segue. I want to get your take on this because it's tinfoil hat time. Because what you just said there, public health never did this, but as we see, they did this, and a lot of people on our quote unquote side of it, like there's a million different reasons as to people think why this happened, but I guess my first question would be, do you think the virus was naturally occurring from bats, or do you think it came from the lab in China? And hey, we're allowed to say that on YouTube now.
Yeah, apparently. So I hear it. It's awesome. No, I think at this point I'm 100%, not 100%, you can never be 100, but I'm like 99% that this was an engineered virus. The question to me is whether it was it deliberately released or was it an accidental release?
That was going to be my next question.
Yeah, I think it's more likely, from what I've read, I think it's more likely accidental, and then there's this whole trail of things that happened to kind of cover up all the shit that had gone down, that cover up the funding of the Wuhan lab and Daszak and his, what's the name of the group that won't come to me, but all of this kind of like the way that USAID shuffled money and did the shell game so that people couldn't trace it and then moved it off to China to do research on viruses that wasn't legal to do in America. So they funded a Chinese lab with lower standards to do it. I think when they realize, oh shit, that virus escaped and it's going to be pretty crappy for some people, then they went into damage control and just went nuts, in the full force of the CIA, the FBI, Homeland Security, all these global networks just pounded away. And that's why we saw things like Build Back Better. Everybody from like the New Zealand, the Australian Prime Minister, Canadian Prime Minister, Joe Biden, Boris Johnson, everybody Build Back Better, Build Back Better, Build Back Better, yeah. And then it was safe and effective. And I think that's why we saw this coordinated messages, because this was a globalist project that went sour, and the globalists had to cover up their tracks and make everything look good and try to smooth it over. That's my take on it.
I tend to agree. Like I 100% think it was man-made. There's no question about that. I think the whole it's just so absurd that like they could have at least like changed the city of origin, you know what I mean? They're just like, no, just like the bat was the Wuhan wet market, and like we also have this like virology lab that works on coronaviruses, in the same city, but that's fine. I 100% think it is man-made. I'm leaning more towards accidental, just because the implications of it being done on purpose are just, they're a little bit too dark to wrap my head around. And also, like, what would be the benefit of that? Like, everybody suffered, you know what I mean? It's not like this was going to be able to be targeted geographically. Like, once it got out, it got out. Like,
yeah, I would agree with that. I think there are some, I won't go into it, but I've heard some arguments from people saying that there were logical reasons for purposeful release, and then I listen to them and it's like, yeah, I can't say that's wrong, but I just think on the balance of probabilities, I would totally agree with what you just said, and I think it's probably accidental.
Yeah.
But who knows? We may never know.
Yeah. And my last question, and it ties back to like RFK and Jay and those guys getting into the administration down south. Do you think there's going to be some accountability? Like, are we going to see? I know like Biden pardoned Fauci preemptively, which is another hilarious thing, man. Honestly, I got work in the morning. I could rant about this for a lot longer, but like a preemptive pardon for Fauci. Like, it's so obvious, man. Do you think there's going to be any accountability for these people?
I hope. To me, I don't spend my time worrying about it too much. Getting back to I try to forgive people. I try to move on. The bigger thing to me is that we put in place systems and to some extent people who make sure this doesn't happen again. If that happens, then I'm happy. If some of these horrible humans pay for their crimes, that's even better. But I'm not getting too hung up on that. Do I think it'll happen? I think there's a chance some of these people will get found out. Just the stuff that's happening with Elon Musk and the USAID and all these files coming out. And I'm hopeful that things will be unearthed that will be too much to ignore, and that some of these people will roast over an open flame. That would be justice. But do I get hung up on it? Do I worry about it? And is my life going to be not complete somehow if it doesn't happen? No, I've kind of already moved on. It would just be a bonus if it did happen. That's the way I look at it.
Perfect. Chris, I think that's the best advice you could give. Just, live your best life.
Absolutely. You know what? The best thing you can do to get back at these people is to laugh and to have a great life and to see your friends and to move on and to laugh at them. They're ridiculous. The best thing we could do is never take them seriously again when they try to push us to do stupid things.
100%. Man, I'm going to be wrapping up this interview now, but I got to say, man, I thank you so much for everything you've done, for speaking truth, and you really were the canary in the coal mine for, just this narrative that all doctors agree on this, because they don't. And yeah, thank you for everything you've done, and thank you for coming on the show, man. I really appreciate it.
Listen, thanks for thinking of me and reaching out, and I appreciate talking to you. And I've really, really enjoyed the conversation. Thank you.
Perfect. Chris Milburn, everybody. And that's my show for tonight, guys. I had an absolute blast talking to Chris, and I hope you guys enjoyed it too. Before I get out of here, though, I gotta tell you about Chris's Substack, which he runs with his wife, Dr. Julie Curwin. She's a clinical psychiatrist and an award-winning author, and you can find them at Paradox on Substack. Not Paradox, but Paradox. I'll leave a link for it in the description, guys, and thanks again for watching. And as always, I'll see you in the next one. Peace.